Hello, welcome to Anatomy DAHAR series. I am Dr. Abdul Hamid. Today's topic is the nasal cavity, free medical education. The internal nose, nasal cavity. Part of the nose on the face is anatomically classified as external nose. Deep to it is internal nose, the nasal cavity. The internal nose is divided by a thin vertical partition, median nasal septum, into right and left nasal cavities. This is median nasal septum, which divides the internal nose into right and left nasal cavities. Each is a wedge-shaped space, narrower above and wider below. This is narrower above and wider below. Each nasal cavity has four walls. The first, superior wall or roof. Second, inferior wall or the floor. Third, median nasal septum wall. Fourth is lateral nasal wall. Nasal cavity and apertures, openings. This is the sagittal section of the nose. This is anterior. The nasal cavity has two main apertures, anterior apertures and posterior aperture. The anterior aperture, the anterior opening is called nares or nostril, which is piriform, pear-shaped. It opens through the base of the external nose and communicates with exterior. The posterior aperture, posterior opening is choana, means funnel-shaped openings, which opens posteriorly into nasopharynx. Choana has bony boundaries, that is, it is surrounded by bones above, below, lateral, and medial. Walls of the nasal cavity. This is the sagittal section of the nasal cavity. This is anterior. The first wall is roof of the nasal cavity. This is roof of the nasal cavity. It is long and narrow space. It is anteroposteriorly divided into three parts. This is the first part, this is the second part, and this is the third part. The first part is sloped downwards and forwards, formed by frontal bone and nasal bone. The second part is horizontal, formed by cribriform plate. Third part is downwards and backwards slopes and formed by sphenoidal body and basi-occiput. Second wall is floor of the nasal cavity. It is the upper surface of the hard palate. Anterior 3/4 of this hard palate is formed by palatine process of maxilla, and posterior 1/4 is formed by horizontal plate of the palatine bone. Subdivisions of the nasal cavity. Each nasal cavity is subdivided into three areas. The first is vestibular area, also called vestibule. The second is respiratory area. Third is olfactory area. Now let's talk about vestibular area or vestibule. This is the one. It is most anterior and inferior part of the nose, at the beginning of the nasal cavity, just above the nares, nostril. It is limited above by liman nasi, this is the one, liman nasi, also known as the external nasal valve. The vestibule is walled laterally by major alar cartilage and fibrofatty tissue lined by the skin, the cuticular part. Structures of the vestibule. We are looking the base of the nose from below, showing the structures of the vestibule. This is the vestibule. Each major alar cartilage, B, is U-shaped, comprises of lateral crust and medial crust. Lateral crust and medial crust. Most of the free margin of the alar of the nose is formed by fibrofatty tissue and not by alar cartilage. So most of this vestibule is formed by fibrofatty tissue and the cartilage is formed only in front. Therefore, the lateral wall of the nose, the vestibule, is formed by lateral crust of the major alar cartilage and fibrofatty tissue. They are lined by the skin, the dotted line. 2 to 3 minor alar cartilages are located in the fibrofatty tissue. Histology of the skin of the very first part, vestibule. The vestibule is made up of major alar cartilage and fibrofatty tissue and lined by the skin, cuticular part. We have already mentioned this part. Therefore, it consists of stratified squamous keratinized epithelium with coarse, stiff vibrissae hairs, sebaceous glands, and sweat glands. The liman nasi is mucocutaneous junction between the vestibule, which is lined by the skin, and the respiratory area, which is lined by mucous membrane. The vestibular area is supplied by general sensory nerve from the maxillary division, that is the second division of the trigeminal nerve. Subdivisions of the nasal cavity. Respiratory area. This is the second part. It is the entire part of the nasal cavity except the vestibular part and olfactory part. It is the largest among the three. Anterior part of this respiratory area, which is just above and behind or posterior-superior to liman nasi, is a bit shallow and called atria, means the entrance. Mucous membrane of the respiratory area. The respiratory area of the nasal cavity and all the paranasal sinuses are lined by respiratory mucosa, that is pseudo-stratified ciliated columnar epithelium with mucus-secreting goblet cells. These are pseudo-stratified ciliated columnar epitheliums. These are mucus-secreting goblet cells. The respiratory area is rich with neurovascular supply. This area received general sensory nerve from the maxillary division, that is the second division of the trigeminal nerve. This is the ethmoid bone located at the base of the skull. It is a complex bone. Let's identify the parts of the ethmoid bone. This is called crista galli. On either side of crista galli is cribriform plate, consists of so many foramina. Downwards extension of crista galli is called perpendicular plate of ethmoid bone. This is lateral mass of ethmoid bone. This is lateral surface of the nasal cavity. This is a nasal cavity here. From the lateral surface, there's a bony projection, shaft-like projection comes out, called turbinate. Above the turbinate here is still lateral wall of the nose. And this is your cribriform plate, and this is your perpendicular plate of the ethmoid bone. This little nook where I put asterisks is called sphenoethmoidal recess. Okay, now we are going to talk about olfactory area, the third area of the nasal cavity. Olfactory area is located in the sphenoethmoidal recess. This olfactory area is area for smell. So this olfactory area is now, if you see, it is upper surface of the superior turbinate, lateral wall above the superior turbinate, inferior surface of the cribriform plate, and lateral surface of the perpendicular plate of ethmoid. This is the area olfactory area is located. This is the area for smell. Mucosa, olfactory mucosa, olfactory neurons from the olfactory mucosa will go through the foramina and enter to the olfactory bulb, which is located above the cribriform plate. Olfactory bulb is the very first part of the first cranial nerve, olfactory nerve. Subdivisions of the nasal cavity. The third area is olfactory area. In this slide, we have two diagrams. This is the coronal section of the nose, and this is the sagittal section of the nose. This is the nasal cavity. This is the uppermost part of the nasal cavity. Just now we have already mentioned this is the sphenoethmoidal recess, where olfactory area is located. If we repeat again, the olfactory area is at the upper surface of the superior turbinate, lateral wall of the nose above the turbinate, lower surface of the cribriform plate, and perpendicular plate of the ethmoid bone. We have already mentioned in detail in previous slides. If you see on the sagittal section, this is the olfactory area, the third area, just below the cribriform plate. Histology of the olfactory epithelium. This is cribriform plate. Above is anterior cranial fossa, where olfactory bulb is situated above the cribriform plate. This is part of the first cranial nerve, olfactory nerve. This is the roof of the nasal cavity. This is exactly is sphenoethmoidal recess, where olfactory area, olfactory mucosa are located. In this olfactory epithelium, we have olfactory receptor cells are there. These are the olfactory receptor cells. They are bipolar neurons. Through the foramen in the cribriform plate, they communicate with the cells in the olfactory bulb. In addition to the olfactory cells, olfactory epithelium consists of basal cells, supporting cells, and Bowman's glands. It is the only area in the body where the nerve cells are exposed and retrievable. The end, illustrated and presented by Dr. Abdul Hamid Abdul Rashid. Free medical education. For the benefit of future users, the author welcomes short comments and suggestions from the readers. Thank you.